Hello, this is MichelleSmith presenting my HelathIT topic for NR512 Nursing Informatics, February 12th, 2017. Before we get started on this presentation, I'd like to start with audience participation. Although not mandatory, it is easy as raising your hand and taking a look around the room to see what others answer as well. Let's take a quick survey on common technical devices. So again, please raise your hand if you have, use, or own any of the following. Internet at home or a hotspot. Raise your hand if you've used that or you own one. PC or a laptop or a desktop at home. Don't forget, take a look around the room and see others' responses as well. A tablet. This could be an iPad, Google Pixel, Samsung Galaxy, maybe a Microsoft Surface. Now here's the big one. Cell phone. Raise your hand if you have a cell phone. Survey number 2, almost done. So this one we're going to complete, and you'll raise your hand for the answer yes in regards to doctor visits. So would you prefer to stay in the comfort of your home when you're sick as opposed to sitting in the doctor's office? Raise your hands for yes. How about, would you like to save money? Do you enjoy fast and convenient service? Again, raise your hand for yes. And last question. Finally, who has suffered from an acute or chronic condition? Perhaps diabetes, maybe asthma, or as simple as the flu, sinus infection, a deer tick bite? Raise your hand. Thank you. Now for the unveiling of my HelathIT topic. Before I do, I must state that as a nurse, it often feels like a number of my peers view technology versus medical care as if they are two fighting forces, when in actuality, they should be viewed as joining pieces in the delivery of healthcare. It is with this in mind that I chose the HelathIT topic of virtual visits, which I'll refer to as VV throughout the slides. With virtual visits, patients are able to see and speak to medical professionals from mobile devices such as a PC or laptop or a tablet or a phone. Does that sound familiar? With the use of internet or hotspot service. You may have heard of these referred to by other names such as Express Care Online, which is what I personally use through the Cleveland Clinic, or MD Live or Teledoc, and many other names. So what do you suppose is the impact of virtual visits on practices today? Well, to start, the demand for advanced nurse practitioners and physician assistants will increase. And actually, this is already happening today. Why do you think that is? Well, for starters, insurance reimbursements. Did you know that over half of the United States are being reimbursed for virtual visits? Also, virtual visits are addressing the issues that are currently increasing our healthcare costs. Some of these issues are unmanaged chronic illness, increased lengths of hospital stays, and hospital readmissions. So before we go on, let's think about the survey at the beginning of this presentation. Do you think that more people who have chronic illnesses or an acute illness would be more willing to seek care that's easy as staying in the comforts of their home? Let's think about maybe a congestive heart failure patient who doesn't feel like driving 20 miles to their doctor's office, parking in the garage, walking to the office, sitting in the waiting room, waiting to be called back to the doctor's office, sitting again and waiting for the doctor to come in, just to let the doctor know that they gained a few pounds and the doctor prescribed them an increased dose of Lasix. So for this congestive heart failure patient, making a virtual visit call can make it so much easier. They could make the call, talk to the doctor face-to-face, get their prescription refilled or increased, and possibly avoid a hospital admission, or if indeed they needed to be hospitalized, perhaps it would shorten their length of stay. So with all the ideas and practices, there are some pros and cons. So let's start with the good stuff. Virtual visits provide fast and remote medical attention. This is a big deal for outreach in rural communities such as the Amish or others that live a great distance from their doctor or medical facility. The cost is reduced. In an article written by Kiebra, the cost of virtual visits is said to be $100, with many of them being less than $50. White coat syndrome is decreased and visits can be recorded. Now, this is sort of near and dear to me. You see, my husband suffers from white coat syndrome. White coat is when a patient experiences high blood pressure in a clinical setting that they may not otherwise have had that same high blood pressure reading. My husband can't stand the doctor's office. He sweats and is freaked out by blood, needles, exams, you name it. He doesn't like it. So much so that not only does his blood pressure go up, but he doesn't even comprehend anything that the doctor is telling him. So let me tell you, my husband loves virtual visits. Another pro is that patients who feel their illness is not that serious or ones who have chronic illnesses, now they have an additional opportunity to have their conditions managed prior to having to be admitted to the hospital. How about bad weather conditions or commute issues? These are terminated with virtual visits. Let's think about that. Those that have to catch public transportation, like the elderly, or those who have to try and endure severe cold or hot weather. What about the Amish that I discussed earlier who typically travel in horse and buggy? Finally, hooray for us! NPs and PAs are able to care for patients via virtual visits. This is another opportunity for us to reach out to our clients. Okay, so now to the areas that need some improvement. The cons. So the first one is limited diagnostic tools. Think about it. Most people may have at most a thermometer, maybe a blood pressure cuff, and a scale at home. Outside of these, diagnostic tools are very limited and can pose an issue in being able to properly diagnose the patient via a virtual visit. Currently, the medical practice laws are very broad and vague, and primarily they still focus on face-to-face interactions. Next, there's an issue of unconfirmed privacy and possible HIPAA violations. See, in a doctor's office, the medical professional can view who's present in the room, close the door, and discuss private matters. With virtual visits, confirmed privacy isn't quite as easy. Who's to say that someone else isn't sitting nearby and can hear what's being said or even see the screen? Another con is technology knowledge gap. Recall when I gave you my explanation for choosing this topic. I stated that there was a known disparity between technology and medical care. I purposely left that gap because this is a current issue that we have today, not just amongst nursing professionals, but also amongst our patient population. most notably the older nursing or older patient populations that are either reluctant or set in their ways or simply haven't had the opportunity to learn how to properly utilize technology. It is the knowledge gap that we must fill in order to allow both medical care and technology to have the highest possible positive effects on healthcare. In terms of application and relevance of informatics to the topic of virtual visits, well, medical professionals must be technically savvy. This means that doctors, nurses, and other medical professionals must gain a certain level of knowledge in the use of hardware and software. This means being able to use PCs, tablets, and smart devices, and even the third-party connections like cameras or microphone devices that might be needed too. It also includes being proficient in the use of various software programs, not just Epics and electronic medical record programs, but also the medical support apps and health management programs that are available today. Healthcare providers must modify or upgrade their current technology in order to be able to offer virtual visits as an option to their patients. This includes being able to educate their patients on how to use virtual visits prior to initially being used. We need to stay current with the new apps and devices that assist in managing health. With this, technology is not going away. Just for the sake of this presentation, I Googled the words health devices, and here are some of the cool images that were returned. Watch to monitor your blood pressure. All types of monitoring tools, a sleep apnea machine, scale, an imaging to see a fetus, heart monitoring. This is a blood glucose device that plugs right into your iPhone or your smart device. Blood pressure and pulse readings. This one looks like it's measuring the impact or the pressure points in the foot. So these are just a few things that technology is just taking off today, and not to say that we have to be, masters at every single one of these programs, but we certainly must know what's available to be able to educate our patients and assist them through this technology wave. So, future recommendations. I recommend that we reevaluate or rewrite medical practice laws and HIPAA Privacy Act rules. Have comprehensive training for medical staff. Suggest the use of screen deflectors and headphones and other ways of confirming privacy when utilizing virtual visits. We need to have the inclusion of device education with discharge instructions. So just like when we discharge a patient and go through their medications and their next visit, we should also include how to utilize their devices in order to set them up and prepare them for future virtual visits. I think that home healthcare agencies should include virtual visits as part of their offered services as well. Oftentimes they go out to elderly homes or other people who have issues getting into doctor's offices, and they too could take part in the education and setup and assisting with technology and virtual visit devices. I think that incentives and cost savings should be offered for those who participate and utilize virtual visits. And finally, I think that we just need to increase engagement and advertisement in rural communities. I think that the more that this is offered and talked about and promoted, the more that we will be able to get people another option to live healthier, taking away some of the obstacles that remain with having to come into a doctor's office for sometimes things that just don't need to have a face-to-face in the same room interaction. So to wrap this up, let's recall the survey we took at the beginning. It actually summarized the opportunities to use virtual visits and identified the use and practice. Well, because the internet is something that many people have at their homes. Even if they're not in the home, people still may have access to hotspots on their cell phones, internet access at public libraries, a lot of public places, Starbucks, public buildings often are now utilizing a free internet service. Many people own a laptop or a PC or a tablet, and smartphones we know are really making their way. Actually, my father-in-law tried to get his flip phone fixed, and none of the cell phone service stores would actually fix it, and he was forced to move to a smart device. So as far as the doctor's office, we all agree that we prefer to stay at home instead of sitting in a doctor's office when we were sick. And I'm not sure there's anyone who doesn't want to save money, especially when it comes to doctor and medical fees, huh? And who doesn't want fast and convenient service? After all, we live in a microwave society. We want it done, we want it now and fast. And many of us have had an acute or chronic condition that has warranted medical professional attention. So yes, there are some areas that need attention, but virtual visits are great opportunities to increase health participation amongst patients. This is MichelleSmith, and I do appreciate you. Have a great day.